The ophthalmic nerve is a branch of the trigeminal nerve and is a general sensory nerve for the upper face. It receives impulses from sensory receptors in several locations in the orbit that course along three primary branches: the frontal nerve, the lacrimal nerve, and the nasociliary nerve. The frontal nerve brings sensory information from the upper eyelid and forehead along the supratrochlear and supraorbital nerves. The lacrimal nerve brings sensory information from the lacrimal gland. The nasociliary nerve has several sensory branches in the orbit. The infratrochlear nerve innervates the skin medial to the orbit. The anterior and posterior ethmoid nerves innervate the ethmoid sinuses. The anterior ethmoid nerve also innervates the mucosa and the anterior superior nasal cavity. The nasociliary nerve continues on to the dorsum of the nose as the external nasal nerve. It innervates the tip of the nose and is a useful nerve to assess nasociliary function in a clinical exam. Of the many branches of the nasociliary nerve, only the long ciliary nerves enter the eyeball. They contain sympathetic fibers that innervate the dilator pupillary muscle located in the iris. Only two nerves enter the eyeball: the long ciliary nerves just described and the short ciliary nerves. The short ciliary nerves are branches of the ciliary ganglion. They contain parasympathetic postganglionic fibers and general sensory fibers. The sensory route courses from the nasociliary nerve to the ciliary ganglion. The sensory route carries sensory fibers which pass through the ganglion from the eyeball. These sensory fibers are responsible for sensory innervation to the eyeball. The ophthalmic nerve traverses the superior orbital fissure to enter the middle cranial fossa. It joins the trigeminal nerve, which contains the sensory cell bodies of the trigeminal nerve.